Hello, everyone, and welcome. I'm so excited to talk with you today about something I'm incredibly passionate about: the three pillars of modern aesthetics: traditional treatments, advanced technology procedures, and injectables. Over my years in this industry, I've seen so many women confused about when they need a simple peel versus when it's time for laser treatments, or when injectables are actually the right choice. And honestly, that confusion is totally understandable. There's so much information out there, and let me tell you, a lot of it is marketing rather than medical advice. So today, in the next 30 minutes, I'm going to break down all the main procedures in simple words. No scary medical jargon, no sales pitch. Just honest, practical information about what works, when it works, and who it works for. Think of this as a conversation between friends over coffee, not a medical textbook. Let's dive in. Traditional aesthetics. Traditional aesthetics include everything done by hand: chemical peels, facials, microneedling, facial massage. I always start here because, honestly, you'd be surprised how many problems can be solved right at this level without moving to more invasive options. Chemical peels. Let me break down the three levels of chemical peels for you. Superficial peels: glycolic, lactic, mandelic acid. When I recommend these, your skin looks dull and tired. You have uneven texture. Fine lines are starting to appear. You're dealing with oily skin or clogged pores. You want that fresh, glowing look. How they work: these peels dissolve the very top layer of dead skin cells. Think of it like polishing a gemstone. You're revealing the fresh, bright skin underneath. What you can expect: a series of 4 to 6 treatments spaced 2 weeks apart. Immediate glow after each treatment. Minor flaking for 1 to 3 days. Honestly, most people don't even notice it. Smother, more radiant skin. Who they're perfect for: pretty much everyone. Even younger clients in their 20s can benefit from these as a preventative measure. I love these peels because they're so versatile and forgiving. Medium depth peels, TCA, yellow peel. When I recommend these: significant hyperpigmentation or sun damage, acne scarring, more pronounced wrinkles. When superficial peels aren't giving you the results you want anymore. How they work: these penetrate deeper into your skin, triggering more intensive cellular renewal. We're not just polishing the surface anymore, we're actually renovating the upper layers. What you can expect: 2 to 3 treatments, spaced about a month apart. Real improvement in skin texture and tone. 5 to 7 days of noticeable peeling. You'll want to plan for some downtime. Dramatic results in evening out skin tone and smoothing texture. Who they're perfect for. Generally, I recommend these for clients over 30 with specific concerns that need addressing. These require more commitment, but the results are worth it. Deep peels. Phenol peel. Now, let me be completely honest with you about deep peels. When I recommend these and it's rare: severe aging concerns. Deep wrinkles that other treatments haven't improved. Significant sun damage. Scarring that hasn't responded to other treatments. How they work: a phenol peel penetrates down to the reticular dermis layer. This is essentially a chemical facelift. The results can be absolutely dramatic. What you need to know: this is typically done once in a lifetime, or maybe once every 10 to 15 years. We're talking 2 to 4 weeks of serious recovery time. Crusting, redness, the works. This is only safe for fair skin types. On darker skin, there's a real risk of permanent pigmentation changes. This is done in a medical setting, requires lab work and preparation. After this peel, your skin becomes permanently more sensitive to sun exposure, and I mean permanently. Here's my honest opinion: I rarely recommend deep peels anymore. Why? Because we have safer alternatives now: fractional lasers, SMAS treatments, that give similar results with easier recovery. Technology has evolved, and that's a good thing. My advice: start with superficial peels. They deliver excellent results without the drama. Save the aggressive treatments for when you truly need them. Mechanical cleansing and extractions. Ultrasonic facial cleansing. I usually combine them in one procedure. When I use this, oily skin with blackheads and congestion, clogged pores. When you need deep cleaning but can't afford downtime. How it works: ultrasonic vibrations gently loosen and remove debris from your pores. It's thorough but non-traumatic. What to expect: clean, refined pores, matte finish on oily skin, every 1 to 2 months for maintenance. Zero downtime. You can literally do this on your lunch break. Manual extractions. When I recommend this: severely clogged pores that need hands-on attention. Closed comedones that won't respond to other treatments. What to expect: deep, thorough cleansing. Some discomfort during the treatment, I won't lie to you. Redness for a day or two. But oh, the satisfaction of truly clean skin. Microneedling, Dermapen, Dermaroller. This is one of my favorite treatments, and here's why. What it is: we create controlled microinjuries in your skin using tiny needles. Your skin responds by ramping up collagen and elastin production. Essentially, we're tricking your skin into healing itself and becoming younger in the process. When I recommend microneedling: acne scars and post-acne marks, fine lines and wrinkles, stretch marks, yes, even on the body, loss of skin firmness, enlarged pores, overall skin rejuvenation, depth matters, 0.5 millimeters. For better product penetration, think of it as creating highways for your serums. 1 to 1.5 millimeters for skin renewal and fine lines. 2 to 2.5 millimeters for scars and significant texture issues. Check the instructions for each device to clarify the depth settings for each area of the body or face. What you can expect: a series of 3 to 6 treatments, 4 to 6 weeks apart. 2 to 3 days of redness and some swelling. You'll look a bit sunburned. The magic happens gradually. You'll see visible improvement over 2 to 3 months as your collagen builds. Critical point: this must be done with quality, single-use cartridges. This is not where you want to cut corners on cost. Cheap equipment can lead to scarring and infection. Facial massage. I can't stress enough how underrated facial massage is. Lymphatic drainage massage. When I recommend this: puffiness and under-eye bags, fluid retention in the face, that overall swollen look, especially in the morning. What it does: moves excess fluid out of your facial tissues, creates definition and contour. A series of 10 treatments gives you the best results. Sculpting massage. When I recommend this: loss of muscle tone, you want to maintain your jawline and facial contours. As preventative maintenance. What it does: tones facial muscles, provides a gentle lifting effect, 10 to 15 treatments in a series. Here's the reality check. Facial massage is wonderful for maintenance and mild concerns. But if you already have significant tissue descent, that sagging we call ptosis, massage alone won't be enough. You'll need to move into device-based treatments or injectables. Advanced technology aesthetics. All right, now we're moving into the territory where traditional methods aren't quite cutting it anymore. This is where technology comes in, and honestly, the advances in this area over the last decade have been remarkable. IPL Photofacial, Intense Pulsed Light. This is one of my go-to treatments for pigmentation and vascular issues. When I recommend IPL: brown spots and sun damage, broken capillaries and rosacea, what we call vascular concerns, uneven skin tone, post-inflammatory hyperpigmentation from acne. How it works: pulses of light target melanin in dark spots and hemoglobin in red blood vessels. The light energy converts to heat, which breaks down these targets. Your body then naturally eliminates them. What you can expect: 3 to 5 treatments, spaced 3 to 4 weeks apart. The spots get darker before they flake off. Don't panic when this happens. Even clear skin tone, minimal downtime, maybe a few hours of redness. This is definitely a fall and winter treatment because sun exposure afterward is a no-go. Real talk, If you're dealing with melasma, IPL can sometimes make it worse. For melasma, I prefer other approaches. Radiofrequency skin tightening. This is where we start addressing sagging and loss of firmness. When I recommend RF, you're starting to lose definition in your jawline. Skin laxity anywhere on the face. That jowly look is beginning. You're over 35 and gravity is starting to win. You want lifting without needles. How it works: radiofrequency energy heats the deep layers of your skin to about 104 to 108 degrees Fahrenheit. This heat causes existing collagen to contract, giving you immediate tightening, and triggers new collagen production over the following months. Types of RF devices. Monopolar, the most powerful, deepest penetration. Bipolar, gentler, better for sensitive skin. Fractional, combines tightening with surface renewal. What you can expect: 4 to 6 treatments, 1 to 2 weeks apart. You'll see some immediate tightening from tissue contraction. The real magic happens over 2 to 3 months as new collagen builds. Results last 12 to 18 months. The sensation? A deep, warm feeling. Most people find it quite pleasant. This is your choice when you want to lift and tighten without surgery or needles. It's one of the best non-invasive options we have. Fractional laser resurfacing. This is serious skin renovation. When I recommend fractional lasers, acne scarring that hasn't responded to other treatments, deep wrinkles, enlarged pores, significant sun damage, texture issues that make your skin look older than you feel. How they work: the laser creates thousands of microscopic treatment zones in your skin, leaving surrounding tissue intact. This triggers your skin's healing response, and over the following months, you literally grow new skin. Types you should know about: non-ablative, like Fraxel, works beneath the surface without wounding it. Gentler with quicker recovery. Ablative, CO2, erbium, actually vaporizes the top layer of skin. More dramatic results, but significant downtime. What you can expect: non-ablative, 3 to 5 treatments. Ablative, usually just 1 or 2 treatments. Recovery time: non-ablative, 3 to 5 days of redness and flaking. Ablative, 7 to 14 days with crusting and significant peeling. The result: it's like erasing 5 to 10 years. New skin, new you. Important: this is not a treatment for beginners or for bargain shopping. You want an experienced provider with a good laser. Period. SMAS ultrasound lifting, Ultherapy, soft wave. This is the big gun for lifting without surgery. When I recommend SMAS, significant sagging. You're over 40 and things have really started to drop. You want real lifting results, but surgery isn't an option. Jowls and neck laxity. How it works: focused ultrasound energy penetrates down to the SMAS layer. That's the superficial muscular aponeurotic system, the same layer plastic surgeons work on during a facelift. The ultrasound creates targeted thermal coagulation points, which causes tissue to lift and tighten. What you can expect: just 1 treatment. That's it. Results become visible over 2 to 3 months. Peak results at 6 months. Lasts 18 months to 2 years. I won't sugarcoat it. This can be uncomfortable. We use numbing cream and pain medication. Cost: it's expensive. Expect to pay $80,000 to $150,000 or more for a full face. But compare that to surgery. This is your choice when you have serious aging concerns, but you're not ready for or don't want a surgical facelift. This is the closest non-surgical option we have. Microcurrent therapy. This is gentler than the treatments we've just discussed, but don't underestimate it. When I recommend microcurrent: puffiness and fluid retention, loss of muscle tone, as a preventative treatment, after more aggressive procedures to aid recovery. How it works: very low-level electrical currents stimulate your facial muscles and improve lymphatic drainage. It's like a workout for your face. What you can expect: 8 to 10 treatments for a full series. Immediate freshness and glow. Subtle toning effects. It's actually quite relaxing. This is your choice when you want gentle maintenance, you're not ready for aggressive treatments, or you want to support other procedures you're doing. Injectable aesthetics. Now, let's talk about injectables. I know many of you might feel nervous about needles, but let me demystify this for you. When done correctly, injectables are incredibly safe and effective. Neurotoxins, Botox, Dysport, Xeomin, Jeuveau. Let me start by saying, I'm a big believer in preventative neurotoxin use. When I recommend neurotoxins, dynamic wrinkles, those lines that appear when you make expressions. Forehead lines, frown lines between your brows, the 11s, crow's feet around your eyes, for prevention before deep lines set in, TMJ and teeth grinding, excessive sweating. How they work: neurotoxins temporarily relax the muscles that create expression lines. When the muscle can't contract as strongly, the overlying skin smooths out. Common treatment areas: forehead, those horizontal lines. Between the brows, vertical frown lines. Around the eyes, crow's feet. Chin, dimpling and puckering. Neck, platysmal bands. What you can expect: results appear in 3 to 7 days. Full effect by 2 weeks, lasts 4 to 6 months on average. With regular treatments, results often last longer. Minor bruising is possible but uncommon. Critical point: the line must be from muscle movement. Neurotoxins can't help with static lines, wrinkles that are there even when your face is at rest. For those, you need volume replacement or resurfacing. Common myths I want to bust: it does not make your face frozen when done correctly. It does not accumulate in your body. It is not addictive. You will not look worse if you stop. You'll just gradually return to baseline. My advice: start in your early to mid-30s with conservative amounts as prevention. Don't wait until the lines are deeply etched. It's much easier to prevent than to correct. Dermal fillers, hyaluronic acid. Fillers are about restoration and enhancement. When I recommend fillers, volume loss in your cheeks, temples, under eyes. Nasolabial folds, those lines from nose to mouth. Marionette lines, from mouth down to chin. Lip enhancement, volume and definition. Deep static wrinkles. Contouring, chin, jawline, nose. How they work: hyaluronic acid fillers replace lost volume, fill in lines, and create structure. Think of them as scaffolding that supports your skin from underneath. Filler densities: light, lips, superficial lines, tear troughs. Medium, nasolabial folds, cheeks. Heavy, cheekbones, chin, jawline. What you can expect: immediate results. You see the change right away. Lasts 6 to 18 months, depending on the area. Lips metabolize faster, 6 to 9 months. Structural areas last longer, 12 to 18 months. Minor swelling for a few days is normal. Bruising is possible. Critical points: only go to an experienced, qualified injector. I cannot stress this enough. Fillers can enhance beautifully or create disasters. The difference is skill. Less is more. You can always add, you can't easily subtract. If you have sagging, fillers won't lift. They'll just add weight. You need lifting procedures first. When fillers are not the answer. If your problem is descent and sagging rather than volume loss, adding filler will actually make things worse by weighing tissues down further. Bioremodeling and skin boosters. This is one of my favorite treatments for overall skin quality. When I recommend skin boosters, dry, dehydrated skin that creams can't fix. Dull, tired-looking complexion, crepey texture, loss of elasticity. As preventative care, preparing skin for summer or recovering from sun exposure. How they work: we inject hyaluronic acid into the skin itself, not under it like fillers, to deeply hydrate and stimulate your own collagen and elastin production. Popular treatments: Profilo, 70 Hyal, Redensity 1, Volete. What you can expect: 2 to 3 treatments, 2 to 4 weeks apart. Your skin will look dewy and luminous. Improved elasticity and firmness. Effects last 4 to 6 months. Minimal downtime, maybe some tiny bumps for a day. Best timing: spring before summer exposure or fall to recover from summer sun damage. This is your choice when your skin quality itself is the problem, when it's thin, dry, crepey, and creams just aren't cutting it anymore. Mesotherapy. Mesotherapy is targeted treatment. When I recommend mesotherapy, hair loss and thinning, localized pigmentation, acne and post-acne concerns, cellulite for body, specific skin concerns that need targeted nutrition. How it works: we inject customized cocktails of vitamins, amino acids, peptides, and other active ingredients directly where they're needed. Common cocktails: for face, vitamin C, glutathione, peptides; for hair, growth factors, peptides, vitamins; for brightening, vitamin C, kojic acid; for acne, specific therapeutic combinations. What you can expect: 4 to 6 treatments weekly. Gradual improvement in your specific concern. Nourished, healthier skin or scalp. The difference from skin boosters: bioremodeling uses pure hyaluronic acid for hydration. Mesotherapy uses therapeutic cocktails for specific problems. When injectable treatments are your best choice. You have clear expression lines. Neurotoxins will erase them. You've lost facial volume. Fillers will restore it. Your skin is dehydrated and lifeless. Skin boosters will revive it. You need fast results for an event. Non-invasive procedures aren't delivering the results you want anymore. You want natural-looking enhancement. Combining treatments strategically. Here's where experience really matters. Knowing what to combine and what to separate is crucial for both safety and results. The ideal sequence: first, cleansing, facials, gentle peels. Second, renewal, medium peels, microneedling, lasers. Third, hydration, skin boosters, bioremodeling. Fourth, muscle relaxation, neurotoxins. Fifth, lifting, radiofrequency, SMAS. Sixth, volume restoration, fillers if needed. Safe combinations in one session: neurotoxins plus skin boosters, radiofrequency plus microcurrent, gentle peel plus facial treatment. Never combine neurotoxins plus facial massage, wait 2 weeks. Chemical peels plus lasers, risk of hyperpigmentation. Fillers plus aggressive treatments in the same area. Any invasive procedures when you have active herpes, infections, or inflammation. Timing between treatments. Between injectable treatments and device treatments, 2 weeks minimum. Between different laser treatments, 1 month. Neurotoxin maintenance, every 4 to 6 months. Filler touch-ups, as needed, based on how you metabolize them. A word of advice: be patient. Your face should evolve gradually, not transform overnight. Subtle, natural enhancement that happens over time always looks better than trying to do everything at once. Age-appropriate treatment protocols. Let me give you realistic protocols for different life stages. Ages 25 to 30. Prevention is key. Traditional treatments: monthly facials, superficial peels, massage. Technology: microcurrent if desired, but not essential yet. Injectables: skin boosters, once or twice yearly, preventative neurotoxins if you have very expressive features. Philosophy at this age: you're investing in your future face. Light, consistent maintenance. Ages 30 to 35. Maintenance mode. Traditional treatments: regular facials and peels, occasional microneedling. Technology: IPL for pigmentation, microcurrent treatments. Injectables: neurotoxins in active areas, skin boosters twice yearly. Philosophy at this age: we're preserving what you have and addressing early signs. Ages 35 to 45. Active intervention. Traditional treatments, medium peels, regular microneedling. Technology, radiofrequency is becoming essential, fractional lasers as needed. Injectables, regular neurotoxins, skin boosters, fillers. If volume loss is apparent, philosophy at this age, we're actively managing aging using multiple modalities. Ages 45 and beyond. Comprehensive approach. Traditional treatments, supportive role. Technology, SMAS, or radiofrequency regularly. Laser resurfacing for renewal. Injectables, full arsenal. Neurotoxins, fillers for volume restoration, skin boosters. Philosophy at this age, strategic, comprehensive rejuvenation. We're using everything in our toolkit. Common mistakes and essential rules. Let me leave you with the wisdom I've gained from years in this field. What not to do. 1. Don't jump straight to injectables when technology might solve your problem. Just because something is popular doesn't mean it's right for you. 2. Don't overdo fillers. I see this too often. More is not better. Your face should look like you, just refreshed. 3. Don't treat sporadically. Consistency matters more than intensity. Regular, moderate treatments beat aggressive, occasional ones. 4. Don't bargain shop for medical procedures. This is your face. Cheap treatments can cost you dearly in complications and corrections. 5. Don't neglect home care. Without proper SPF and skincare, even the best treatments will fail faster. Sunscreen is non-negotiable. I really can't emphasize this enough. What you should do. 1. Start prevention early. What you invest in your skin at 30 pays dividends at 50. 2. Listen to your provider. If they say you're not ready for something, they're protecting you. If they recommend something simple when you want something dramatic, they're being honest. 3. Commit to series when recommended. One treatment rarely delivers lasting results. Most procedures work cumulatively. 4. Combine approaches. The best results come from thoughtfully combining traditional technology and injectable treatments. 5. Be realistic. Aesthetic treatments can create remarkable improvements, but they're not magic. At 50, you'll look like a beautiful, well-maintained 50, not 30. The most important rule: your goal should never be to look 20 years younger. Your goal should be to look like the best possible version of yourself at your age, refreshed, radiant, confident. Remember, we're not trying to stop time. We're trying to age beautifully, gracefully, and on our own terms. Thank you so much for your time and attention today. I hope this has clarified things for you and given you a solid foundation for making informed decisions about your aesthetic journey. Please subscribe to channel. If you have questions or want to discuss about your journey, write in comment below. The most important thing is that you feel informed, empowered, and excited about the possibilities.